when people sort of get to that point where they're really struggling with things and they sort of seem like they've hit a brick wall, sometimes you have to remind them of why they entered into this process and this journey to begin with, and to sort of help bring them back to an understanding of what their original goals were for weight loss, for better health, help them to realize ways to get past whatever it is at the time.
Somebody can come in, like I said, and they can lose 10 pounds every month. And somebody can come in following the rules, and they can lose 5 pounds every month. And so we have to really look at what they're eating, not so much how much, but what they're eating. And how much exercise are they getting? And then I look at that and I really take it apart. And I'll talk to them and I'll change their exercise routine for them. Change the intensity, change the weights, and adjust them. And the next time they come in, they may lose a little bit more. So it kind of just depends. We have to adjust things all the time.
To me, education and support is a key component in what we do. If we can't help them guide through those lifestyle changes, just adding fluid to the band isn't going to make that a successful tool for them.
They can email me back and forth, and a number of other ones are keeping track of their diet and their diary, and they're emailing me their diaries, and I'm commenting on them and telling them great ways to change it, or great job, or maybe try this and then we'll talk about when you come in next month.
This is a tool to help you lose weight. You're going to learn something about it every single day, every single month for years to come.
We have a monthly support group that meets Saturday mornings, and we have a discussion with people who have had bands, people, the provider, one of us will come and discuss any specific concerns about the band mechanics, complications, but usually it has to do more with them discussing it. Would be like any support group. They relate more to each other. We're there to be kind of take in the information and answer questions.
We take a lot of phone calls, and if they think it's something at midnight, they email us, and then we email them back the next day with what our thoughts are. You know, we need to talk on the phone, you need to come into the office, or here's a quick answer to your question type of thing. A lot of our patients will drop in the office between their visits because they do have a question or a concern. So we try to make it as patient and client family-centered as possible in our office.
The band's a tool. It's I tell them it's going to be about 20% of their weight loss is going to be wrapped up in the band, and the other 80% is going to be their diligence in responding appropriately to the band.
I have them keep a food diary. There's been proven success with, they'll lose about 70% more weight if they keep a food diary. You have to exercise, watch what you eat, and stay motivated the whole time.